Good afternoon, Mike Jones, Fire Chief, City of Fredericksburg, here to provide you an update on COVID-19 and some issues about the environmental conditions that will happen over the next couple of days. First, let's do the statistics. As of to this morning, there are 1,646 total positive cases in the health district. That's cumulative over a period of time. Right now, the city has a grand total of 172. We had no new cases overnight. Stafford's at 738, Spotsylvania at 590, King George at 70, and Caroline at 76. We have dropped significantly, at least in this last reporting period, down to 9 cases. So that's the lowest we've had in a good long while. We were up in the 30s, 40s, and even 50s and 60s earlier. So only 9 cases. Still maintaining steady at 18 deaths. Most of all the deaths have been in people that were 50 years or greater, and a lot of them had comorbidities related to that. Testing continues to ramp up. We're still testing somewhere between 200 and 400 people per day in the health district. They're testing somewhere between 6,000 and 10,000 statewide. Statewide numbers, the positivity rate there has continued to drop, and it has been dropping for the last week or two, and it's down to about 11% total positives against the number that they've actually tested. In the Rappahannock Health District, we're lagging behind a little bit. We are down to 13%. We were up above 17% about a week ago, so we are trending in the right direction. That's good. Right now, we only have 34 positive patients in area hospitals. So there are some positive signs there, not only in the state numbers, but also in the national numbers, and we'll provide those on our written report as well. So as we enter into the first really warm days of the year, it's always good to remember the rules when participating in outdoor activities. This is especially important in hot, humid conditions. If you're going outside to work, exercise, or play, please plan to pre-hydrate. That's, in other words, drink ahead of time before you go out there, water or sports drink, things like that. And do that for several hours before you go out and participate in those activities. Wear light-colored, loose-fitting clothing made out of breathable fabrics like cotton, so that'll help wick away some of the perspiration and things like that. Limit your time in the direct sunlight. If you're working or exercising, take frequent breaks to rehydrate with water or sports drink. If you will be in the direct sunlight for extended periods of time or are particularly sensitive to the light, please use the appropriate sunscreen with a high SPF factor. So that's important that you do that. Make sure you plan your walk or run to have areas of both sun and shade. That's important. If you start to feel nauseated or dizzy, stop what you're doing, sit down, rest outside of the sunlight. If you need help, don't feel bad, call 911 or get a friend to pick you up, something like that. Don't continue on with your exercising or activities if you're starting to feel bad. Exercise in short periods and conduct it early in the morning or late in the afternoon, right before sundown. Those are the times when the temperatures start to drop off, the humidity conditions start to drop off, and that'll help you. Know the differences between heat exhaustion and heat stroke. Heat stroke is a life-threatening condition, so you really need to know that. We've got a pictogram that I'll include with the report today, so check out our written report so you can see that and know all the differences to differentiate between what is heat exhaustion and what is a true life-threatening emergency known as heat stroke. Doesn't happen that often, but you need to know about it, especially with these warm conditions. And we'll talk again Friday, where we'll plan to discuss a little bit about the governor's Phase 2 operations as they'll go into effect on Friday, June 5th. Thank you.